an expert professional. So now ultrasound was done, confirmed nodule. Next step we need to know is the following. These are the features of ultrasound characteristics that we should worry about. The hypoechogenicity, as we mentioned, and we show in the pictures. The calcification, especially if it's a punctate or the microcalcification rather than a microcalcification. Taller than wide shade of nodule, irregular margins, and increased vascularization. Okay, so now we need to know what is the TSH. If the TSH was suppressed, okay, so it means that we have, it seems to be an active nodule. So we need to check that by nuclear medicine to see how active is that nodule. So perhaps we are dealing with just autonomous nodule, and hemithyroidectomy will be advised for this condition. Calcitonin, it's another biomarker, can be used in patients with suspected and suspicious nodules. If the calcitonin is elevated, if it's very elevated, then those patients are advisable to have total thyroidectomy. If it's mildly elevated, next step is a fine needle biopsy. If the malignancy risk is high, so for example, there is a history of radiation, head and neck radiation, or total body radiation, or there is a predisposition syndromes, or the patient has got macrocephaly, and you remember those gene mutations that we mentioned, the P10, for example. So there is a malignancy risk here. And if the patient has got suspicious nodule with these kind of features that we mentioned, certainly fine needle biopsy is needed. If there is no suspicion, just ultrasound review after 6 to 12 months, and then you reassess going through this circuit. If based on the biopsy results, the pathologist will help you to classify the results into, if it's non-diagnostic, that's Bethesda 1, benign features, Bethesda 2, indifferent, that's 3 and 4, suspicious is 5, and malignant is 6. So if it's suspicious or malignant, the advice is either total thyroidectomy or hemithyroidectomy. If it's indifferent, Bethesda, class 3 or 4, repeat the biopsy in 6 months' time. If it's a benign feature, just ultrasound follow-up after 6 to 12 months for at least 5 years. This is important for follow-up based on the Bethesda finding here. If it's non-diagnostic, then repeat the ultrasound and the biopsy after a minimum of 3 months. And then according to the finding, you just go back into this